Question 1. Which client situation requires the most immediate infection control intervention? A post-op patient with a red surgical site. B. A patient with watery diarrhea sharing a room. C. A patient with a chronic wound dressing change. D. A patient with an old tracheostomy tube. Answer. B. A patient with watery diarrhea sharing a room. Question 2. A nurse is assigning tasks during an outbreak of norovirus. Which task is appropriate to assign to the UAP? A. Administering antiemetics. B. Performing hand hygiene education. C. Cleaning contaminated surfaces with bleach. D. Assessing dehydration. Answer. C. Cleaning contaminated surfaces with bleach. Question 3. Which action by the nurse shows a break in sterile technique during a urinary catheter insertion? A. Donning sterile gloves. B. Touching the inner part of the sterile catheter tray. C. Draping the patient after opening the kit. D. Using sterile lubricant. Answer. B. Touching the inner part of the sterile catheter tray. Question 4. What is the priority nursing action when a central line dressing becomes saturated? A. Document the drainage. B. Reinforce the dressing. C. Replace the dressing using sterile technique. D. Notify the provider immediately. Answer. C. Replace the dressing using sterile technique. Question 5. A client on neutropenic precautions asks about food safety. Which food should the nurse advise to avoid? A. Canned peaches. B. Well-done beef. C. Fresh salad with spinach. D. Boiled white rice. Answer. C. Fresh salad with spinach. Question 6. Which action by the nurse violates infection control during medication administration via a nasogastric tube? A. Flushing with tap water. B. Wearing gloves. C. Verifying placement first. D. Using the same syringe for multiple medications without cleaning. Answer. D. Using the same syringe for multiple medications without cleaning. Question 7. What is the nurse's best strategy to reduce central line-associated bloodstream infections, CLABSI? A. Flush the line every 24 hours. B. Perform sterile dressing changes. C. Administer antibiotics with every flush. D. Use double gloves when accessing the port. Answer. B. Perform sterile dressing changes. Question 8. Which of the following is the correct way to transport a patient with active pulmonary tuberculosis? A. No mask is needed if the patient is not coughing. B. Patient wears a surgical mask during transport. C. Nurse wears an N95 mask during transport. D. Transport is not allowed under any circumstances. Answer. B. Patient wears a surgical mask during transport. Question 9. A nurse is reviewing infection control with new staff. Which statement by a new nurse indicates a need for further teaching? A. I remove gloves before leaving the room. B. I perform hand hygiene after removing gloves. C. I recap needles after giving injections to reduce exposure. D. I clean equipment between patient use. Answer. C. I recap needles after giving injections to reduce exposure. Question 10. Which nursing action reduces catheter-associated urinary tract infection CAUTI risk? A. Irrigating the catheter every 8 hours. B. Securing the catheter to the leg. C. Using sterile technique only during insertion. D. Placing the drainage bag on the bed. Answer. B. Securing the catheter to the leg. Question 11. A nurse is caring for a pediatric patient with chickenpox. What infection control precaution is required? A. Contact precautions only. B. Airborne and contact precautions. C. Droplet precautions only. D. Standard precautions only. Answer: B. Airborne and contact precautions. Question 12. A patient with a surgical wound develops a fever and purulent drainage. What is the nurse's priority action? A. Administer antipyretics. B. Document the findings. C. Notify the provider. D. Cover with a sterile dry dressing. Answer: C. Notify the provider. Question 13. Which action prevents cross-contamination in a multi-patient room? A. Using gloves when entering the room. B. Performing hand hygiene between patients. C. Wearing the same gown for both patients. D. Using a shared stethoscope between patients. Answer: B. Performing hand hygiene between patients. Question 14. What is the best response to a family member who refuses to wear PPE while visiting an isolation patient? A. You can visit for a short time without PPE. B. You are required to wear PPE to protect yourself and others. C. Just wear gloves. The gown is optional. D. If you're vaccinated, PPE is unnecessary. Answer: B. You are required to wear PPE to protect yourself and others. Question 15. Which nursing action reflects proper technique when removing an isolation gown? A. Untie at the waist, then neck. B. Touch the outside of the gown when folding it. C. Remove gloves after the gown. D. Fold the gown with the contaminated side inward. Answer: D. Fold the gown with the contaminated side inward. Question 16. A patient with C. difficile is being discharged. Which teaching is essential? A. Use alcohol-based hand sanitizer at home. B. You can return to work once diarrhea stops. C. Wash your hands thoroughly with soap and water. D. Antibiotics prevent recurrence. Answer: C. Wash your hands thoroughly with soap and water. Question 17. What is the most effective method to sterilize surgical instruments? A. Washing with hot water. B. Using alcohol wipes. C. Steam under pressure autoclaving. D. Soaking in saline. Answer: C. Steam under pressure autoclaving. Question 18. A nurse prepares to assist with wound irrigation. Which PPE is most important to prevent splash exposure? A. Gloves and shoe covers. B. Mask and face shield. C. Cap and sterile gloves. D. Surgical gown only. Answer: B. Mask and face shield. Question 19. Which nurse action best prevents surgical site infections? A. Administering antibiotics after incision closure. B. Maintaining normothermia intraoperatively. C. Delaying wound closure. D. Using clean gloves for dressing change. Answer: B. Maintaining normothermia intraoperatively. Question 20. A nurse notices a UAP discarding gloves into a regular trash bin after providing perineal care. What is the appropriate response? A. Remind the UAP to use a biohazard bin. B. Report the UAP to the nurse manager immediately. C. Ignore since it's a minor error. D. Reassign the UAP to another unit. Answer: A. Remind the UAP to use a biohazard bin. Question 21. A nurse is preparing to enter the room of a patient with measles. What PPE is required? A. Surgical mask and gloves. B. Gown, gloves, and surgical mask. C. N95 respirator. D. Gown and face shield only. Answer: C. N95 respirator. Question 22. Which practice by a nurse violates surgical asepsis? A. Holding sterile objects above waist level. B. Turning back to a sterile field. C. Opening sterile packages away from the body. D. Using sterile gloves. Answer: B. Turning back to a sterile field. Question 23. A client with MRSA has a new roommate assigned. What is the nurse's best action? A. Allow room sharing since MRSA is common. B. Delay assignment until infection control clears it. C. Inform the roommate to wash hands frequently. D. Place both patients on airborne precautions. Answer. B. Delay assignment until infection control clears it. Question 24. When caring for a patient on contact precautions, which action is appropriate? A. Wearing gloves only. B. Using PPE only if touching the patient. C. Wearing gown and gloves upon room entry. D. Placing the patient in a negative pressure room. Answer. C. Wearing gown and gloves upon room entry. Question 25. Which type of precaution is appropriate for a patient with pertussis? A. Contact precautions. B. Droplet precautions. C. Airborne precautions. D. Neutropenic precautions. Answer. B. Droplet precautions. Question 26. What is the most effective way to prevent healthcare-associated infections? A. Daily linen changes. B. Routine use of antibiotics. C. Proper hand hygiene. D. Wearing masks at all times. Answer. C. Proper hand hygiene. Question 27. What is the correct action after removing gloves that touched contaminated material? A. Apply hand lotion. B. Wash hands with soap and water. C. Put on clean gloves immediately. D. Wipe hands with alcohol pad. Answer. B. Wash hands with soap and water. Question 28. Which situation requires use of sterile gloves? A. Feeding a patient. B. Emptying a Foley catheter bag. C. Performing wound debridement. D. Assisting with ambulation. Answer. C. Performing wound debridement. Question 29. Which infection control action should be performed first after a needle stick injury? A. Report to the supervisor. B. Clean the area with soap and water. C. Test the patient's HIV status. D. File an incident report. Answer. B. Clean the area with soap and water. Question 30. A client in isolation throws soiled linens on the floor. What should the nurse do first? A. Leave the linens and call housekeeping. B. Use gloved hands to return linens to a hamper. C. Instruct the client on proper disposal. D. Document the incident. Answer. B. Use gloved hands to return linens to a hamper. Question 31. Which action best prevents transmission of influenza in a hospital? A. Wearing an N95 respirator. B. Encouraging vaccination among staff and patients. C. Wearing a gown and gloves for all patient care. D. Restricting all visitors. Answer. B. Encouraging vaccination among staff and patients. Question 32. A nurse is caring for a client with hepatitis A. Which instruction is appropriate? A. Wear a mask during patient care. B. Wash hands after patient contact. C. Keep the room door closed. D. Avoid wearing gloves. Answer. B. Wash hands after patient contact. Question 33. Which of the following is true regarding standard precautions? A. Only apply to patients with infections. B. Include wearing a mask for every patient. C. Are used for all patients regardless of diagnosis. D. Require gown use at all times. Answer. C. Are used for all patients regardless of diagnosis. Question 34. A patient with shingles is admitted. What precautions should be implemented? A. Contact only. B. Airborne and contact. C. Droplet only. D. Neutropenic. Answer. B. Airborne and contact. Question 35. What should a nurse do before removing a mask after exiting an isolation room? A. Remove gloves first. B. Untie the neck strap of the mask. C. Perform hand hygiene. D. Remove the gown. Answer: C. Perform hand hygiene. Question 36. Which client requires protective reverse isolation? A. A patient with tuberculosis. B. A patient undergoing chemotherapy with neutropenia. C. A patient with C. difficile infection. D. A patient with pneumonia. Answer: B. A patient undergoing chemotherapy with neutropenia. Question 37. A nurse is assessing knowledge about infection control. Which action demonstrates correct glove use? A. Touching phone with gloved hands. B. Changing gloves between procedures on the same patient. C. Washing gloves between patients. D. Using gloves as a substitute for hand hygiene. Answer: B. Changing gloves between procedures on the same patient. Question 38. A nurse is caring for 4 patients. Which one should be placed in a private room? A. A patient with a stage 2 pressure injury. B. A patient with new-onset diarrhea and fever. C. A post-op patient. D. A patient with controlled asthma. Answer: B. A patient with new-onset diarrhea and fever. Question 39. Which of the following is a correct method to clean a blood spill? A. Use hot water and paper towels. B. Use alcohol and let air dry. C. Clean with bleach solution. D. Spray with air freshener. Answer: C. Clean with bleach solution. Question 40. What is the correct response to a glove tear during a sterile procedure? A. Apply a new glove over the torn one. B. Continue the procedure carefully. C. Change both gloves and glove using sterile technique. D. Use alcohol to disinfect the glove. Answer: C. Change both gloves and glove using sterile technique. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.